Greetings, listeners and learners. Welcome to the second episode of Healthcare Headlines, a podcast summarizing the recent major healthcare news and what you need to know. I'm Dan Grauman, Managing Director and CEO of Veralon, a management consulting firm that helps clients with their most challenging issues in strategy, finance, M&A, physician alignment, and physician compensation. We also offer our virtual board education solution, which is a tech-enabled, video-based governance education platform for board trustees. This podcast will also live on our virtual board education platform. So let's jump right in. First up is an update on antitrust enforcement of hospital mergers. Congress has increasingly focused on scrutinizing healthcare mergers. However, a study by the American Economic Association found that federal regulators are falling short in their enforcement actions against hospital mergers, so we can anticipate there will be more friction in this space. Turning to some more specific merger cases, the FTC brought suit to block the acquisition of certain CHS facilities by Novant. On another front, the FTC also sued to block a transaction where HCA wants to acquire 5 Utah hospitals from Steward. You may remember last month we reported that Steward went bankrupt and is selling 31 hospitals across the nation. Finally, in Indiana, 2 hospitals merged, and they relied on the Certificate of Public Advantage law, otherwise referred to as COPA, that allows mergers even if the FTC otherwise considers them illegal. Certain states have this law, and other hospitals have relied on it in the past. Next, here's an update on Risant Health. You'll recall that Kaiser established Risant Health to invest in selected not-for-profit health systems throughout the country. Their first deal was with Geisinger Health System, and now they've announced their second alliance with North Carolina-based Cone Health. They intend to focus on continued expansion into becoming a value-based care organization in response to the shifting healthcare landscape towards value-based care. Next, an update on private equity and healthcare roll-ups. Last month, we reported that private equity was encountering significant headwinds in their healthcare investments. Here's more data on what's happening in 2024. From a high of over 1,000 deals in 2021, private equity investing in 24 in healthcare is on an annual run rate of only 400 deals. The sharp decline is due to regulatory headwinds on the antitrust front, post-pandemic patient volume and revenue changes and challenges, supply chain challenges, and labor cost issues as well. Next up is an update on Walgreens. Recently, they opted to reduce their ownership of the primary care provider VillageMD, for which they had invested billions in the past. This marks a continued decline of large retailers' roles in primary care delivery. In 2024, VillageMD closed almost half of its clinics, and Walgreens was a majority owner but has now reduced its equity stake. In related news, supermarket chain Publix launched a virtual care service to keep pace with its competitors like Costco, Kroger, and Albertsons. Interestingly enough, this comes in the wake of Walmart's decision to shut down its virtual care services in April. So clearly, these consumer-focused major retailers continue to experiment with their role in virtual care and healthcare delivery. The topic of site-neutral payments is once again front and center. This has been a discussion for several years, and the provider sector continues to anticipate its implementation. Recent efforts to get this site-neutral payment legislation through Congress have fallen short. So what does it mean? Payments for healthcare services provided would be the same regardless of the setting in which they're provided, hospital versus ambulatory, with significant implications for where health systems should locate their range of ambulatory services. Proponents are pushing for these site-neutral payment reforms to be passed through Congress in a year-ending spending package. Perhaps the end of 24 will finally be the time when this legislation becomes a reality. Next is an update on Medicare's ongoing quest to experiment with different payment models. Through the Center for Medicare and Medicaid Innovation, otherwise referred to as CMMI, Medicare is rolling out the TEAM model, TEAM, which stands for Transforming Episode Accountability Model. It's an episode-based payment model where selected acute care hospitals will be required to coordinate care for traditional Medicare patients after they receive surgical procedures. They'll be responsible for coordinating care post-discharge and ensuring that care is delivered in the most effective and efficient manner. Hospitals, of course, are concerned about this program and that it will burden providers and require significant upfront investment. They're also concerned that the model places too much risk on providers with little opportunity for reward. Medicare has been experimenting with these models in an effort going back several years to try to control the rate of increase in healthcare costs, especially for traditional Medicare patients, and in light of the silver tsunami that is well underway. At the same time, Congressional Republicans are criticizing CMMI for its failure to generate healthcare savings. A report from the CBO, the Congressional Budget Office, in October 23 showed that CMMI increased direct spending and spent more on these operating models than realized savings in healthcare. This will continue to be a politicized issue since CMMI goes back to the establishment of the ACA, or Obamacare, in 2010 and has been on a quest to experiment and establish payment models that deliver care and align incentives in a more effective and efficient manner. And finally, here's an update on AI, or artificial intelligence, and clinical documentation. The Generative AI Scribe program at Bon Secours Richmond reports to have reduced physician documentation time by hours. Virtual scribes at Mass General's Brigham are linked to reduced time in electronic health records for providers as well. However, at the same time, nurses are concerned about AI integration into EHRs and emphasize they view AI as just a tool, but definitely not as a replacement for the work they do in patient treatment. Nurses are also raising concerns about patient safety. This will be a long and winding journey in terms of integrating AI into healthcare delivery. We'll report on it more in the future. So that covers the major healthcare headlines for the past month. The one constant we can count on in healthcare is change. So tune in next month for new developments in episode 3 of Healthcare Headlines.